Here we'll learn about key causes of nausea, vomiting, and diarrhea. In this tutorial, we'll give just a cursory description of each cause, but you can learn more about them in our notes. We'll begin with nausea and vomiting. Note that vomiting is technically defined as forceful eviction of the stomach contents caused by contractions of the GI tract and muscles of the thorax. But we'll also include some disorders characterized by regurgitation, which is when food is ejected from the esophagus. First, indicate that several medications are known to cause nausea and/or vomiting, particularly antibiotics, opioids, antidepressants, vitamins and mineral supplements, NSAIDs, and chemotherapy. Then indicate that GI motility issues can prevent normal passage of food and result in nausea and vomiting. This can be due to damaged nerves or mechanical obstruction. For example, we show esophageal achalasia, which is a rare condition in which the nerves in the esophagus are damaged and the lower esophageal sphincter cannot relax. As a result of sustained sphincter contraction, food cannot pass to the stomach and patients experience heartburn, chest pain, and regurgitation, a backflow of food into the throat. We also show gastroparesis, which can result from vagus nerve damage and loss of stomach muscle function. Food is not pushed through the stomach to the small intestine properly, so patients feel full after eating small amounts of food and may experience heartburn and vomiting or regurgitation. Mechanical GI obstructions include adhesions, volvulus, foreign bodies, hernias, tumors, etc. Indicate that motion sickness is a common cause of nausea. It occurs when there's a mismatch between our expected and experienced sensory inputs. Our brains become confused about whether the body is stationary or moving. Early pregnancy is associated with nausea and vomiting. Although it's often referred to as morning sickness, these symptoms can occur any time of the day and are a result of hormonal changes in the first trimester. Central nervous system disorders can also produce feelings of nausea and vomiting. Examples include migraines, infections, and events that cause increased intracranial pressure, such as brain tumors or injury. Cerebellar strokes are an important key cause of nausea and vomiting, so we should look for other localizing or lateralizing neurologic findings. Lastly, indicate that cyclical vomiting syndromes characterized by recurring severe episodes of vomiting that can be brought on by stress and excitement. This syndrome is rare and often begins in childhood. It's thought to be the result of disordered brain-gut interactions and is often associated with the development of migraines. Write that complications of vomiting, particularly after prolonged periods, include aspiration, a movement of vomit into the lungs, dehydration, electrolyte imbalance, undernutrition, and esophageal tears. Next, let's learn some common causes of diarrhea. First, indicate that lactose intolerance causes diarrhea with abdominal pain and cramping. Lactose is a sugar found in mammalian milk and requires the enzyme lactase for breakdown in our GI systems. There are different causes of lactose intolerance, but the most common cause in adults is a primary lactase deficiency. Then indicate that celiac disease is another dietary cause of diarrhea. In some individuals, gluten, which is found in wheat, rye, and barley, triggers an inflammatory autoimmune response in the small intestine. Another type of autoimmune disease that causes diarrhea is inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis. We show that they are characterized by mucus and bloody diarrhea, respectively. Indicate that inflammatory bowel disease also includes microscopic colitis, which is characterized by watery diarrhea. Then write that pancreatic insufficiency is characterized by a lack of digestive enzymes. As we might expect, this means that foods and liquids aren't absorbed. As a result, patients have watery diarrhea due to osmotic forces in the intestines, and steatorrhea, which is due to the malabsorption of fats. We show that steatorrhea, also known as fatty stools, is characterized by oily, foul-smelling stool that is often yellowish and floats due to its high fat content. Lastly, indicate that neuroendocrine tumors can cause diarrhea. For example, Carcinoid Syndrome, which occurs in 30 to 40% of patients with these tumors, is associated with watery, loose stools, as well as flushing, wheezing, and valvular heart disease. Indicate that complications of diarrhea include malabsorption of nutrients, dehydration, and electrolyte imbalances. Finally, let's indicate some disorders that produce nausea, vomiting, and diarrhea. First, indicate that Gastroenteritis is a common cause of these symptoms. Infections can be from a variety of pathogens that are consumed with tainted food or water. That top causes include norovirus, rotavirus, especially in children, E. coli, Salmonella, Shigella, and Campylobacter. Then indicate that intestinal ischemia, which occurs when the mesenteric arteries become blocked, can cause nausea, vomiting, and bloody diarrhea. Functional bowel disorders include irritable bowel syndrome, which is the result of disordered brain-gut communication. And lastly, endocrine disorders can produce GI issues, particularly thyroid disorders, adrenal insufficiency, and diabetes. This concludes our diagram.